We go now to our reporter Lora Windsor, who has more on women and heart disease.
Roger, according to the National Coalition for Women, almost every minute a woman in the United States dies from heart disease. Nearly 5 times as many women will die from heart attacks alone this year than will die from breast cancer. We spoke with Dr. Adnan Naber at Desert Regional Medical Center in Palm Springs, California, who gives us more on women and heart disease, and asked him if men are more at risk than women.
No, heart disease is the #1 killer of women as well as men. It's definitely heart disease that's the killer, and heart failure in particular is the #1 reason women and men are hospitalized in the U.S. In women, it's usually 10 years later. The onset of coronary artery disease, or the narrowing of the arteries, becomes more evident. The reason for that is because the estrogen actually protects the women in more ways than one.
How different is it for a woman having a heart attack opposed to a man having a heart attack?
Pretty much the same, but there are some odd presentations like fatigue and palpitations are more common. But actually, chest pain is more common in women than men, believe it or not. More than half of the heart attacks that occur actually are silent. People don't even realize they're having a heart attack. Various ways that they can prevent nausea, vomiting, shortness of breath, GI upset. Even headaches and fatigue are often signs of something's going on. When women have a heart attack, it sometimes presents differently in that it's usually a larger heart attack because they ignore the signs and the symptoms of the event, and the other reason is they present later. They usually hold off on presenting to the emergency room or to see their doctor in reference to their symptoms.
Is the recovery the same for men and women who have had a heart attack?
They usually present at an older age, and it's actually more debilitating when the person has let it advance to that stage, so the damage has already been done. So it actually leads to heart failure and multiple other comorbidities, other medical problems that make it harder to treat women. Generally, women don't do as well as the men because in the past they weren't treated as aggressively as men.
Dr. Naber gives some good advice to women about their heart health.
Women in general should be more conscious of the risk factors that cause the heart attack. For instance, physical inactivity is a common problem, and obesity is unfortunately an epidemic in the U.S. and the world, and it's becoming worse. And that obviously causes other problems like diabetes and heart failure. In general, it's basically a healthy lifestyle is what we strongly recommend. Low fat, low cholesterol diet, no added salt, controlling the blood pressure, and exercise.
Remember, you can reduce the risk of heart disease by getting regular checkups and living a healthy lifestyle. For the American Health Journal, I'm Lora Windsor.